Hi, I'm Nurse Barb, and this is your daily dose. If you've decided to use hormones to treat your menopausal symptoms of hot flashes, night sweats, maybe vaginal dryness, and you've done your research, you've talked to your healthcare provider, your pharmacist, you come home with your prescription and you open it up, and many women are very surprised to see in the package insert that there's a black box warning saying that estrogen causes breast cancer, possibly cardiovascular disease, and maybe even dementia. What's up with that? Because you've done your research, you've been reassured, and yet in the package insert, it says that it's a very risky thing to do. This is very confusing, and it can be very maddening for women because this information, which I have right here, this is a black box warning from my own estrogen prescription. It negates all of the benefits of estrogen, and it's based on a study from 2001. That's over 20 years ago. And that one study did not look at bioidentical hormones. It looked at one preparation that was being used at the time. It was Prem-Pro, or Premarin and Provera, and these are oral medications. And what's interesting about that study and what's not reported is that the women who only used Premarin, that is the women who only were on estrogen, they actually had a reduced risk of breast cancer. It was only the women who were using both estrogen and progesterone in the form of Prem-Pro who had a slightly increased risk. And that risk was about the same as a woman who doesn't get 30 minutes of exercise at least 6 days a week. So when you decide to use hormone replacement therapy in estrogen and progesterone, if you're using bioidentical hormones, that black box warning does not apply. And the North American Menopause Society and many other societies are working with the FDA to try to get this black box warning changed. It's known as class labeling, which means that all estrogens carry the same warning, regardless of the data that shows that this is not appropriate. I hope this has helped you feel more reassured. For more information, you can go to nursebarb.com. And if you like this video, please click on like and subscribe. Take care and be well.